Hello students. Today I want to show you the carving of the permanent mandibular canine. As you all see in the diagram here, the mandibular canine, from the labial aspect, it will show the slopes, the distal slope and the mesial slope. The mesial slope shorter, the distal slope longer, shifts the cusp tip towards the distal side. And as we see the labial surface, the actual diagram, if you had seen, the labial surface would show a labial ridge, okay, from the cervical line to the occlusal surface, from the cervical line to the incisal surface, it shows a curve rather, with one ridge in the center. So we will have to show this ridge, we have to show the slopes and the cusp tip for the carving. And on the lingual surface, if you could see, the lingual surface will show the lingual ridge from the cusp tip to the cervical line. You will see a huge cingulum. For the mandibular canine, cingulum would be lesser, and you will see the two fossa on either side, the lingual fossae, that is mesial fossa and the distal fossa. So these are very important landmarks for the labial and the lingual surface of the mandibular canine. So check for the dimensions of this particular tooth. Dimensions of this particular tooth shows the cervico-incisal length of the crown as 11 and length of the root is 16. Mesiodistal width at the crown is 7. Mesiodistal width at the cervical region is 5.5. Buccolingual it is 7.5 at the crown and 7 at the cervical region. So we'll have to maintain roughly these dimensions for this particular tooth. So taking the crown length of 11 centimeter, so 11 millimeters. 11 millimeters, if we take the crown length, okay, roughly. First we'll mark the surfaces. See, on this side we will make the labial surface. Opposite side we'll make the lingual, and the profiles mesial and the distal. From the labial surface, we'll mark a midline where the incisal edge, future incisal surface would be seen. And from the lingual surface and the labial surface, the midline is to be drawn this way. And for your convenience, you can draw two areas like this. But since we have to make one ridge in the center, not much of this would be useful. So if we start making the labial surface of this, so make a curvature from the labial surface. Curvature is from the cervical line, which comes here, to the incisal edge, which comes here, future. So more pressure will be on the incisal and less pressure will be on the cervical region. So we have to leave one ridge in the center, we have to make a ridge in the center, so we will not put much force in the center also. So make it this way. Until we come and reach the midline. So curvature has to be maintained from the cervical line to the incisal edge. More force towards the incisal region. So leaving the center, the oblique ridge, the labial ridge in the center of the labial surface. Do not make an incline, you have to make a curvature. Okay, now we have almost come to the incisal region where we had marked the midline. So this is the labial surface that is made. If you could see here, so we have maintained from the midline the labial ridge. On either side, we have made the curvature from the cervical line to the incisal edge. Okay, and next procedure will be to cut the slopes or the ridges. So cut it completely down like this on either side. Okay, give it a cuspal pattern. Cut it on the acute angles. Okay, in this manner you will give a cusp tip over here. Okay, so this is the labial surface that is made, showing the cusp tip. When we cut at acute angles the slopes, you will get the cusp tip, this fashion. Okay, now we will go to the lingual surface. We'll slightly ditch the cervical region because this will be the future cervical region. Slightly ditch it inwards. Okay, we'll go to the lingual surface, the opposite of it. For the lingual surface, we have to make, if you see the figure diagram, we have to make two fossae and one lingual ridge, and we have to make one cingulum. So for that sake, we will divide the lingual surface into two parts. The larger part we will make the fossa, and the lesser part we'll leave for the cingulum. So the larger part from the midline, we'll try to make one incline. Okay, try to make a incline of this kind. This will be cingulum and this will be the incline. And after that, from the distal and mesial, the profiles, what we will do, we'll slightly converge the crown. Since the crown converges lingually, so lingual surface will not be broad, labial surface will be broader. So for that sake, you have to converge the crown lingually. So from the profiles, mesial and distal, without touching the labial border, you have to give a convergence towards the lingual. Okay, so the tooth would be roughly looking like this from the lingual area. Mesial and distal, we have made these convergence. Okay, we're almost done with the lingual surface. What we have to do, we have to make we have to make one lingual ridge in the center and we have to make two foci on either side. We'll just mark roughly the foci, how we have to make it. Make two fossa on either side, leaving the center for the ridge. We don't have to make the ridge, it automatically comes on its own. Okay, make two foci on either side without touching the edges or the borders of the lingual surface. So the ridge will automatically come on its own. On either side you have made the fossa. Now this part will be the cingulum. So cingulum, please do not touch it until we completely do with the tooth. So we'll slightly ditch the lingual surface as we have done for the labial. So cingulum will come on its own. Okay, so this is the tip, cusp tip. We'll just furnish it from the labial onwards. So this is the cusp tip. The crowd is almost done with the labial part. Not much to be done from the lingual surface apart from these three. Only three landmarks are present, that is the fossa, the mesial fossa and distal fossa, the lingual ridge and the cingulum, the cusp tip. So the lingual ridge is confluent from the cusp tip to the cingulum, and the labial ridge is also in continuous from the cusp tip to the cervical region. So these two ridges are to be maintained for the canine. What happens in the canine? How is it different from the incisors? In the canine, there is a feature of the cusp tip and the ridges, the labial ridge and the lingual ridge, as I just told you. During formation, 4 lobes will form the crown of the canine. 4 lobes will form the crown of the canine. Amongst these, 3 lobes will form the labial surface and 1 lobe will form the lingual surface of the crown. The 3 lobes that form the labial part, that is the mesial, middle and the distal lobes that form the labial surface. Amongst this, the middle lobe becomes highly developed. Middle lobe becomes highly developed than the mesial and the distal lobes. So for that sake, there is formation of a labial ridge in the labial aspect. And 1 lobe that forms the lingual will form the cingulum part. When we compare the maxillary and mandibular canines, mandibular canine will be less exaggerated. Mandibular canine will be less exaggerated. That means maxillary canine shows all features very much sharp. Very sharp features mandibular canine will show. So we will not show so sharp features of the landmarks for the mandibular canine. So this is the crown part. This is the crown of the canine. The labial surface and the lingual surface. We have to make the root So the root length is 16 mm, 16 millimeters from the cervical line roughly. So if we take it, it would come somewhere here, and the root of the canine is regular. Before that, when we come to the slopes, mesial slope is shorter, distal slope is longer. For the mandibular canine, since the mandible is horseshoe shaped, the distal part from the labial surface, the distal part becomes more curved. Distal part is more curved than the mesial because it has to take the shape of the mandibular bone. So the distal part becomes more curved than the mesial half. So this one thing is a differentiating feature for the mandibular canine with the maxillary canine. And all the features, the cusp tip, the ridges, the cingulum, all become very less exaggerated or less pronounced for the mandibular canine. Coming to the root, I told root is 11 millimeters. If we see the textbook, from the cervical line to the tip of the root, it is 16 millimeters, 1 millimeter short of the maxillary canine. It is regular on the labial and the lingual surface. Root is regular and convex. From the mesial and distal, the root is flat. The root is flat and showing developmental depression on the entire root length of the mesial and the distal part of the root. So for that sake, we'll start making the root. First make a cylinder, as you already have done your basics. First make a cylinder out of it. Okay, first make a cylinder out of it from the cervical line and give it the shape of the root, retaining the base. Retaining the base. From the mesial and the distal, will slightly make it flat. The root is flat from the mesial and the distal, as you see in the figure, and it is concave and regular from the labial and the lingual surfaces. We'll just give a mimicking the tip, we shall give just convergence at the tip of the root, and developmental depressions on the mesial surface of the root and the distal surface of the root have to be made. Once more, you can just make the labial surface and lingual surface. You can give one turn to all the sides. Chop off these edges. So if you could see here, this is the lingual surface of the crown, showing the two fossae on either side of the lingual ridge, a cingulum not much exaggerated, and the root part. If you see the labial surface, anatomically we'll have to place this tooth like this. You will see the labial ridge, you will see the two slopes, you will see the cusp tip not much exaggerated, okay? And mesial and distal, you will see the developmental depressions on the root only. So on the whole, the mandibular canine, as I told you, is not exaggerated like that of the maxillary canine. And we will draw the cervical line on the crown, cervical line on the labial surface and lingual surface. It's semi-arc and shows incisal dipping on the mesial and the distal part. Cervical line is a semi-arc on the labial and the lingual surfaces, and it shows incisal dipping on the mesial and the distal side of the root. And now that was the carving of the mandibular canine, permanent tooth. So looking it from all aspects, this is the labial surface showing the labial ridge and the two slopes, the cusp tip, and the lingual ridge showing the lingual ridge and the two fossae on either side, and the cingulum and the cusp tip, and developmental depressions on the root on the mesial side, and developmental depression on the root of the distal side, okay? So that was the carving of the mandibular canine. So taking it in its anatomical position, it would look this manner. Thank you.